So I am a California transplant. I came to Philadelphia in 2002 in pursuit of a second degree BSN MSN program. I have both my BSN and MSN from the University of Pennsylvania School of Nursing. And I pursued my PhD at University of Pennsylvania as well. And that's how I came to Drexel. I started working at Drexel in January 2019, and I actually defended my dissertation April of 2019. So currently I teach in undergraduate nursing, and the course that I am primarily responsible for is population health. In that course, we really focus on looking at social determinants of health, looking at health equity, as well as focusing on vulnerable populations. In terms of my research interest, I really would like to work more with immigrant populations, specifically with Chinese and Asian immigrants, because I am also a first generation immigrant myself. And just through our life experiences, looking at my parents as first generation immigrants and having limited English proficiencies. And, you know, there's a lot of, I see there's a lot of gaps in the literature where these experiences have not been captured. So for example, for my dissertation work, I interviewed low-income recent immigrants and looking at their experience in accessing healthcare in the US, given the resources that they have or don't have. And thinking about how they were able to take care of themselves or not take care of themselves because of their social environment. Well, my first degree was actually in psychology. And what really drove me to nursing was after graduating, I got a position. I got two positions. One was with UCSD as their California Smokers Helpline. So we do provide smoking cessation counseling, so a lot of the health promotion. And then my second job at that time was with Planned Parenthood, and I was working as a medical assistant with them. And through those two jobs combined, I knew that I wanted to work in health promotion. So I always thought I would get like a master's in public health. But the more time I spent at Planned Parenthood, I learned about the role of the nurse practitioner and how that role was able to both do the health promotion as well as provide the direct care. So that's when I was inspired to become a nurse practitioner and start looking up like what steps are involved to become a nurse practitioner. And that's what brought me to Penn, because at that point in time, they had a BSN MSN program. I really like the student engagement, and I really appreciate my colleagues. In terms of student engagements, the students are inquisitive, they want to learn, and when I'm able to introduce a concept to them that either they're familiar with before or not familiar with, being able to still bring like a small aha moment to their learning is really what I like the most about my position. And really, in terms of my colleagues, feeling truly supported by everyone. We truly work as a team, even though we team teach, so to speak, and we each have our special course that we're in charge of, or we teach most in. We still help each other out in the ways that we can, as well as there's always opportunities to try and teaching other courses to expand our own personal teaching portfolio. I think think they almost can be one and the same. One of the best advice I've received, and also would advise for future new faculty members, is, never be afraid to ask questions, and always feel free to bring in new ideas. Because I think that's one thing that's really great about Drexel, is that Drexel is really pro innovation and new ideas, and there's always room for growth.